3.
Hello, my name is Kirsten Steinbeck, and today I'll be doing a trach suction and tear video for you, and it is September 3rd of 2020, and I'm in NUR 400. So I've already brought all of my supplies needed. I'm going to bring it into the room with me, knock knock, come in, introduce myself, ask for their name and date of birth, check their wristband, and then I'm going to go ahead and provide some privacy. And then I'm going to explain to them what we're doing today. And I will already have assessed their respiratory status, their depth, their respiratory rate, the effort it takes, their O2 saturation, and their lung sounds. And then I'm going to go ahead and put my patient in semi-Fowler's position, check their pulse rate, and I'm going to explain what I'm doing very thoroughly again and ask them if they have any questions, answer their questions. And I'm going to go ahead and tell the patient that we need to form some nonverbal communication, like a raising of a hand, so that way I know to pause if they need something. So we're going to go ahead and do that, and then I'm going to ask them to perform that nonverbal communication before we begin, so I know that they can do it. And then I'm going to go ahead and turn my suction from 80 to 120 on continuous, make sure it's working. I'm going to check my patient for any type of secretions coming out their trach or around the area, and any characteristics of the secretions, the thickness, the color, the amount, all of that. And then I will go ahead and check my incision site if I can. And next time I'm ready to hyperoxygenate my patient. So to begin, we're going to go ahead and do trach suctioning. I'm going to go ahead and pour my normal saline in there. Okay, I'm going to dirty this hand. I'm going to make sure we're working. And then I'm going to go ahead and pull this down. And I'm going to tell my patient before I begin that they may feel some discomfort, some need to cough, and that the suction is going to last no longer than 10 to 15 seconds, and between each time we suction, we are going to give it a 30-second rest. And I'm going to begin. And then we're going to clear the secretions out, wait our 30 seconds, and suction again. And we're going to do that one more time. So clear secretions, wait your 30 seconds, and suction again. Okay. And then you can put a Yankar on that if you'd like. And then I'm going to go ahead and remove this old dressing. Throw that in my trash. And we're going to go ahead and continue with trach care. So first I'm going to take this out of here and set it up so the inside of it is sterile. Go ahead and put my normal saline in here as well. And then I will go ahead and I can move that wherever I need. I'm gonna go ahead and get my sterile field out, and I'm going to lay it down, shiny side down. And then I'm going to go ahead and move this by the outside of it. And continue by putting on my sterile gloves. Okay, next I'm going to go ahead and put everything I need in the middle of my sterile field, where I know 100% sure it is sterile. With at least a 1-inch border around it, that is non-sterile. So I'm gonna go ahead and put my peroxide in. And then I will go ahead and put my sterile water in. Okay. And then, since these need to be wet to soak and clean around the area, I'm going to go ahead and put them in here. Almost saline. So now I'm going to go ahead and begin. So I'm going to there we go. And then we're going to put it over here. So now clean it, making sure I keep my right hand sterile. And put it back in my water to rinse. Okay, and when it is done rinsing, I'm going to go ahead and take it out of this, my sterile hand, this back, and go ahead and insert it. So be careful to keep this sterile. So this hand is still sterile, so I'm going to go ahead and take this out with my sterile hand. Move this back down, place it here, and then take one of my applicates. And I'm cleaning around my trach area. Okay, and then next we're going to take a dry one and do the same. So we're going to make sure we have it dry. Then I'm going to take my sterile dressing. I'm going to go ahead and lay it down, apply it, continue applying it until it is all the way reached up. And then next I will go ahead and take off these sterile gloves and continue with a new pair of sterile gloves. So I can go ahead and change my trach collar as well. And I want to have somebody accompany me with this. So I will have a second person there just in case anything happens, so that way they can secure it to make sure that nothing comes off or we don't have any type of complications. So I'm going to continue. So before I take this one off, I just want to make sure that I have my new one on. So I have it on, but before I get it in, I'm just gonna loosely put it on there, and then I will go ahead and remove my old one. And then I will go ahead and tighten this as necessary to make sure that it is secure. And then I will go ahead and I'll continue hyperoxygenating them until they recover respiratory wise. So I'm going to go ahead and stay in the room and assess them, and then I'm going to listen to their lung sounds, check for more secretions. I'm going to assess their respiratory status to make sure that their O2 saturation is where we need it. I'm going to look at their effort, their respiratory rate, the depth of their breathing, and anything else needed. And once I conclude that the patient is stable once more, I can go ahead and decrease their oxygen back to what it needs to be and what it was before we began. And then I will go ahead and document all of this that was performed today and how the patient tolerated it and anything